In this video, we will cover the process of entering pre-op orders electronically from the physician office. To begin the process, you will want to launch the EMR View Patient Routine. From here, you will see that I am automatically sent to my Cover Surgical Cases list. The reason it opened to this is defined within my preferences. On the Defaults tab, I have my initial page being Patient List, and I have my default list as Cover Surgical Cases. What this does for me is it will populate this list with every surgical case for somebody that I'm covering for. I can build coverage here by adding providers and saving them. The nice thing about this is, as you'll see, when I flip through, it'll only stop on days that somebody that I'm covering for has a scheduled case. So if I was trying to enter orders for a patient having surgery later this week, I could flip through. I could also jump to a specific day by clicking on the date here and getting a calendar. In this scenario, I'm going to enter pre-op orders for a test child. Once I open the chart, I will want to go to orders. Now what I will see here is a warning letting me know that certain data hasn't been recorded on this patient. In this case, height and weight. This would be important for me to know if I was trying to order something that was weight-based. Additionally, allergy information, if it wasn't recorded, it would warn you here as well. Allergy information that's been defined on the patient from previous visits can be seen in the header. So here I can tell what allergies the system is aware of, and I know that these are the allergies that it will check against when I'm placing orders. I'm going to go ahead and hit proceed. Now I want to select transfer orders. The reason I am choosing transfer orders is because I'm placing orders for a future date and time. That will put them in a queue to be activated upon when the patient arrives. Somebody in the surgical department will activate or process those orders and make them active. At this point, I want to select the provider that I'm entering these orders for. Most likely, the provider's name will be here in the drop-down for you. This is the provider that the patient is scheduled for. However, if I needed to access an additional provider, I do have the other provider lookup that I can drop down and select from any provider in our dictionary. After selecting the provider, you will want to choose an order source. This is important because it defines whether or not these orders will be electronically signed or not. There is a source for licensed professional that you can use that says I'm entering these orders, and it will queue back for electronic signature. I can use per protocol, meaning that these are by a policy or a protocol that these orders are being entered, and that does queue back for electronic signature, as well as if I've taken a verbal or a telephone order. I can select those sources. In this scenario, I'm going to choose verbal order. After hitting OK, I will select Next to continue. From here, I have the option of entering new orders, new meds, or new sets. New orders will allow me to place individual one-time or individual orders, procedural type orders. New meds will let me place individual medications. And new sets is a convenient way to enter orders that are grouped together. In this scenario, I'm going to select the pre-op surgery order set. Here, I will select the orders that I need for my patient. Note, if there's anything required on an order, you will see the red edit will turn red. I will also get some indication here as to what the required field is. I have the option of filling out the required information on the front screen or clicking into the Edit button to edit the information. This particular order is important because this is the consent for surgery order. You'll want to be sure to fill out this order with the exact information or wording that you want written on the consent. Also note that if I need to make any adjustments, I can do so by clicking into an order. I can get in and change rate or frequency. I can also, the most common strings are available to me on the front end. However, I can use the plus sign to expand and get to additional order choices. So for instance, if I needed something for a specific time, I could do that. Or if I needed something daily for a couple of days, I could do that and define the number of days. As I scroll down, I'm going to make a few more selections. Notice the most common choices are here, but if I needed a different dose, for instance, I can click into the field and define that right here on the fly as well. So I wanted to adjust the dose to 1250, I could do that. If I needed to change the frequency, I could do that, as well as I could go into the edit field. If there's additional orders I need to place that aren't on this screen, I can use the Any Order tab to be able to get in and add additional orders. So maybe I also needed for this patient a chest x-ray the day of surgery. You'll see that I now have the chest x-ray here, and I'm going to make it routine, and I'm going to just say pre-op. After I've entered everything that I've required, I can go ahead and submit. When I get to this screen, I have an opportunity to review everything that I have placed. If I'm okay with all the choices that have been made, I can save selected, and that will send them to the provider's order queue to be signed off on. Note, the only order that exists on the current orders table is that for the transfer. To be able to view the orders that I have entered that are in that hold queue, I would need to select the transfer orders. Now I'm able to see and access everything that was previously entered. If I needed to make adjustments to anything, I could dial in and edit here, anything that needed to be changed. If I needed to cancel something, I could click on the status to undo it. Because this particular order was entered as part of a set, it's going to give me the option to get rid of everything within that set, or I can just continue to just stop the one particular selected item. I can also add new medications or new orders. Once I've made any changes that I needed to, again, I have the opportunity to submit. It's letting me review what I've done, so I'm deleting the LR and I'm at ordering normal saline. And you'll see that those orders are now what is in effect. Next, I want to review the process of adding things to your favorites. So you'll notice that when I clicked New Sets, I'm initially launched to my favorite order sets. These are things that I have defined that I frequently use to place orders. To add things to my favorites, I simply select the Manage Favorites button. Here, I can check off or unselect things that I don't want to be on my favorites. Once I hit Save, you'll see that these sets are now part of my favorites. So having favorite order sets defined allows you to quickly access them without having to go to the category and select or go to the name. I do have the ability still to choose to search for any set within the lookup using starts with or any word, but favorites is just a quicker way for me to access the things that I do more frequently. The same thing is true with new orders. New orders, here are things that I have previously defined as ordering with some frequency. If I wanted to add something to my new order or my favorite orders, I simply, from the point of trying to order it, once I add something new that's not part of it, I have the option of doing Manage Favorites. Here I can choose to have the strings that I frequently use and hit Save. You'll now notice when I go in to place new orders, I have the INR order that I just added with the 2 frequencies that I use most often. And that just allows me, again, a quicker way to enter those orders. Same thing's true with new medications. So once I start searching for something that's not in my favorites, it automatically flips to the name search. I see the item that I want to add. I choose the Manage Favorites. In this case, I want to do the 1250 milligram vancomycin on call to surgery as part of my favorites. And now you'll notice that when I go to New Meds, that item is here and available for me to quickly access. If I've placed transfer orders on a patient and the patient has decided to cancel surgery, or I realize after I did it that I did it on the wrong patient, or something about this has changed and I need to just completely cancel everything I've done, from the Current Orders tab, the transfer order on the status, I can choose to stop and it will get rid of everything within this transfer. The other thing I wanted to show is how to find a patient if I don't go through the process of selecting from my covered surgical cases. I can do a Find Patient and do a name search. Once you select the patient, here's the tricky part, and that's why going from your patient list is the best way to do it. You have to be sure that you are selecting the correct visit to place these orders on. As you can see, this particular patient had a surgery case on 7/3 as well, 7/30 as well as on 8/3. So if I were trying to place orders preoperatively for this patient, I want to be sure that I'm selecting the surgery case for the date that I'm looking for. But then I would be able to go ahead and enter orders. That concludes the review process of how to enter pre-op orders from the surgery office. I want to quickly review with you a document that shows all of the different order sources. I'm going to leave this on the screen for just a few minutes so you can see the names of the order sources, the reasons they're used, and whether or not an order source queues for signature. It's important to know this information because it's important that for every order we have a signature. So whether that signature is electronic, meaning that I've entered an order per protocol and it's landing to my provider sign queue, then I'm going to have an electronic signature for that order. If I'm entering orders from a written order, and I'm choosing the order source of written order, then it's important to realize that the order source of written will not queue for electronic signature. Therefore, that paper order would need to be maintained and scanned into the system, so I would have a record of the provider's signature. So again, it's just important to know which order sources you would use and whether or not they queue for signature, so that we always are sure that we have a signed physician order for all of our orders entered. Thank you.